Good afternoon. My name is Shannon Pickens, and this is my capstone and 5-year plan project. I'm a student at Lamar University. I'm trying to obtain my bachelor's in science degree in nursing. Previously, obtained my ADN at the Galveston College. Professional background includes surgical ICU from 1999 to 2008, IMCU at Herman Memorial 2008 to 2009, and currently I'm in the recovery room from 2009 to the present. I'm a member of AACN organization. I hold certifications in ACLS, PALS, and BLS. First learning objective is humanity and society. Practices safe and effective holistic patient care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. The course was Nursing 4620, Nursing Practice Care of Patients with Compromised Multiple Health States. The assignment was the Practical Reflections 1, 2, 3, and 4, and the CBSL assignment. I had a patient that I interviewed that sustained a head injury because of a car wreck, along with thoracic injuries causing upper back pain and the loss of function of his left arm. I developed a plan of care based on measurable goals, and we talked about 3 nursing interventions that helped to reach that goal. We used the King's conceptual system and theory of goal attainment in nursing practice and nursing theory. And he and I had a teaching and learning session. We discussed 3 resources in our community that he could benefit from and go to for therapy. One was UTMB, and the neurosurgery teams could see him as needed. Also, TIER is a transitional learning facility here in Galveston for head injury patients. And the third was Tideway. They offer water aerobics to gain the muscles back in a non-resistant environment. I feel that this goal was met at 100%. Lifespan, health, and continuum. The learning objective number 2 was support patients and clients in preventive disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. The course was 4316, Comprehensive Holistic Health Assessment. The assignment was Activity 1, Healthy People 2020. The goals were to eradicate the number of hospital-acquired infections. One was make a commitment to prevent hospital-acquired infections through research and implementing the evidence-based practices of gel in and gel out before and after examining patients. I spoke about educating patients and family members on washing their hands on a regular basis before entering a room and after entering the room. And study shows that VRE was decreased by 70% and MRSA infections were decreased by 63%. Learning objective number 3 evaluates patient-centered care for patients, clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. I went to the transitional learning facility here in Galveston and I interviewed and spoke with patients about physical and occupational therapies and their goals to integrate back into society and possibly the workforce. I feel this goal was met at 100%. Evidence-based practice and clinical reasoning. Learning objective number 4 synthesizes clinical reasoning and judgment in nursing practice utilizing critical thinking, nursing process research, and evidence-based practice. The course was Nursing 4550, Nursing Practice Leadership and Management in the Healthcare System. The assignment was Practicum Assignment and Clinical Application. I discussed the best practice with appropriate dosages for pediatric patients, with medications in a safe dosing range, and ongoing pain assessment in children and pediatrics. I feel this goal was met at about 96%. Patient-client-centered care. Learning objective number 5 employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional health care team. The course was 4391, evidence-based practice. The assignment was the discussions 1, 2, and 3. We have come a long way with the help of evidence-based practice and how we practice nursing. We should use the safest and most effective practices for our patients. I feel this goal was met at 100%. Professional roles and construct. Learning objective number 6, differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients, clients as a member of the intra and intra-professional health care team. The course was Nursing 4390, Evidence-Based Practice. The assignment was Group Discussion of Quantitative Research. We discussed the use of mobile devices and their practicality in the nursing field. For example, the use of drug references and calculators can easily be accessible for use when needed. In 4391, we divided up in small groups to do the project. We communicated through text and emails and broke up quantitative research evenly. Each of us contributed a written assignment on how the smartphone app influences undergraduate nursing students' perception of their critical care thinking and clinical decisions. Learning objective number 7 demonstrates professional integrity, effective communication, active inquiry, and service to the community. I identified the at-risk or special needs community members. I went around the community to speak with individuals to assess their knowledge about impending disasters, as we have many hurricanes in this area. I felt I had an impact on assisting their planning in such a case arises. This empowers the at-risk members of the community to know where they can go during such a case. I became involved with the at-risk population, and we discussed resources that open their doors to those in need, such as the Salvation Army, Our Daily Bread, and the Catholic Charities are all places that offer food and clothing. The Our Daily Bread offers breakfast and lunches for free. The Catholic Charities offers the clothing, and all three places that the community members can seek refuge during a storm or any other time of the year, such as in the heat of the summer. I feel that I met this goal at 100%. My 5-year plan includes 2019, graduate from Lamar University with my baccalaureate in nursing. 2020, test and obtain my CPN certification, which is a certified post-anesthesia nurse certification. In 2021, I would like to level up to a nurse clinician 4 and climb the clinical ladder. In 2022, I would like to cross-train to conscious sedation nurse and help when needed during the procedures. In 2023, possibly return to study for my master's in nursing. Thank you for listening to my project, and have a great afternoon. Thank you.